Now then, how are your teeth looking? It's an interesting opening gambit, really, isn't it? Have you thought about, regular checkups? And have you thought about, possibly improving the look of your teeth? I've got Faresh and Gursh from Hereford Dental Clinic. They're in Bath Street. Morning, guys.
Morning.
And they are specialists in proper, good-looking teeth. Now, I mean, I've got to be honest, and you're going to hate me for this, I've got all my teeth, so I have no fear of a dentist's drill. But some people do. And guys, how can we put people at ease about going to the dentist, particularly to your practice, Hereford Dental Clinic?
One of the ways that we make patients feel at ease is that we do offer sedation for our patients. It's something that we do, if patients are very, very nervous about having their treatment done. We make the practice a really relaxing environment as well. We've got TVs, nice smells, scented candles, relaxing seating. Our staff are absolutely fantastic. We really try and make our patients feel at ease that way, really.
And when did you take over Hereford Dental Clinic?
We took over in May 2009, so it's been about 12 months, and the previous practice was called Florida House Dental Surgery. We're totally under new management and ownership. We've transformed the premises and the building, and it's taken us 12 months. We're still working on it. There's still a few bits to sort out. We've given the practice a complete refurb from top to toe. We've gutted it down to the brickwork. We used to have only one treatment room. We've now got 3 treatment rooms. And like I mentioned, the whole environment's more of a spa-like environment. People come in, they feel nice and relaxed. You can sit around, have a cup of coffee before you have your treatment done.
Yeah. So you're giving the place a cosmetic look as well as helping people with their cosmetic
That's
look.
right.
As well.
I mean, we've sort of looked at really making it really relaxing as we possibly can.
Interesting as you were talking there about lighting candles, and putting on serene music. So really making an effort to make people feel at ease.
Yeah, I mean, one of the biggest complaints about dentists and doctors and hospitals is the clinical smell. People walk in and it really does smell like a dentist. So we're trying to kind of get away from that. So as soon as you walk into the door, you can smell something a little bit different. The treatment rooms do smell a little bit different as well. And all of that kind of adds to helping people feel at ease, really.
In your experience in dentistry over the years, what is the most nervous patient you've ever heard of?
Well, we've literally got patients that have not even been able to get out of the car. They've come up on the car park in tears, can't get out of the car. And it's the impression that the practice and the staff give from that point that will really coax them in, get them relaxed. And we've got a consultation room, which means they don't have to come straight in to the dental chair.
So you can chill them before you get them there.
Yeah,
absolutely.
I mean, the consultation room does work really, really well. Patients often don't like talking while they're sitting in the chair because they feel quite, claustrophobic and they feel quite trapped. So we've got, some sofas, like I said, they can have a drink, talk to the dentist, meet the staff beforehand. And that way, they do feel a lot more comfortable. You can build a bit of trust and relationship with the patient. That works really, really well for the nervous patients.
I always find it quite sociable because, although it's a difficult situation where you're being asked questions when you've got instruments in your mouth and you're going, as a response.
We'll try and do it when the instruments aren't in the mouth.
Now, you've got some new treatments that you're offering at the moment because it is British Smile Month. What are your new treatments?
Well, I mean, aside from the general dentistry and hygiene treatment, we do teeth whitening. So looking to give our clients bright white smiles. Veneers, which are thin porcelain coverings to...
That's very popular in Hollywood, isn't it?
Absolutely,
I mean, Simon Cowell's had it done. Most of the British celebs that go over to Hollywood now have that done.
Absolutely.
And what does that entail?
Well, they're almost like... I can liken it to sort of false fingernails, but in porcelain that go over the teeth just to mask any unsightly cracks, old fillings, make them look whiter, straighter, just give that general appearance.
And how do you attach those to teeth? What sort of adhesive would you use?
They're bonded on. They're bonded on using what we term it as a cement, but it's just a very thin gel that sets under a blue UV light. And that tacks them onto the tooth surface.
Yeah, and obviously they make your teeth look all level. Is there any kind of overlap of your real teeth? So when you're chewing something, are you chewing with the veneer or are you chewing with your teeth as well, so that it's level?
Well, the front teeth you'd be biting with the veneers on the back teeth, we tend not to put veneers on the back ones, but you just chew on natural teeth. But we can make veneers look as natural as we possibly want.
Because I have this mental image, like fingernails, of them being slightly lower than your teeth.
Not necessarily.
To create that level look.
Yeah, I mean, not necessarily. They do blend in with your natural tooth surface. People ask for different things. Some people walk in and they'll want, very white teeth. But what we try and do is make it look as natural as possible. We don't want people to walk up to our patients and say, "Oh, have you had veneers?" We'd rather they come up and say, "You've got really nice looking teeth," and that's what we try and aim for.
I always remember that episode of Friends where Ross had them done and they were ultraviolet bright.
That's right, yeah.
So, what about the staff? You also have a practice in London, don't you? Have you brought some of the staff up from there, or have you trained people locally?
Well, no, I mean we've maintained the sort of local staff. When we inherited the practice, we took on 2 members of staff, and we've steadily grown. So we're now up to
10
people 10
in
members.
total. Yeah, so we've in 12 months recruited another dentist. We've got a therapist on board. We've got 6 other members of the team that are there as well.
Yeah. And it all ties in with the treatments. I mean, a lot of the treatments, you mentioned the London clinic, we brought up a lot of treatments that we do down there up to Hereford, things like the dental implants, which are a natural way to replace missing teeth.
So what do you actually put in then?
Into the gap? Well, we're putting... they're almost like titanium pegs that mimic what the root surface, what the root looks like. So where there is a gap, that goes into the space, and we put a nice porcelain crown over the top of it, so no one knows any different. It looks exactly as the tooth was before it was ever lost.
Yeah, we do a lot of orthodontic treatments as well. Where teeth straightening treatments. So kind of gone are the days where you have to wear this kind of ugly Betty metal type of brace on the front of your teeth. We do tooth-coloured braces. We do invisible braces, which can straighten your teeth over a period of time. We can fit braces on the back of your teeth, so no one's kind of none the wiser that you're having anything on there at all. And the treatment's available to anybody. You could be a 12-year-old. I've got a patient who's having braces, or invisible braces. She's 73. Yeah. So it's available to everyone. Yeah. You can. Doesn't matter. There's no age limit to orthodontic treatment or teeth straightening treatment at all.
And teeth straightening is done like that. There's no actual sort of moving it and sort of repositioning it and letting the gum regrow around it or anything like that. It has to be done with braces, that sort of way.
That's the only way to move teeth, and it's the safest way to move teeth and the most natural way.
All right, so it is National Smile Month, and of course we're giving away with Ian Davis in the afternoon next week some electric toothbrushes, each one worth £150, thanks to you guys, each day. What's the message of National Smile Month?
Well, this year's campaign slogan is Teeth for Life, which is highlighting the importance of looking after your teeth, maintaining them for life, and also stressing that healthy diet can improve the quality of your life. I mean, there has been recent research that shows poor dental health. There's a link between poor dental health and common illnesses like heart disease and diabetes. So it's really just homing in on healthy lifestyle, maintaining the teeth for life, and general well-being, really.
I mean, as long as you brush at least twice a day, that's good, isn't it? Morning and night. What about lunchtime? They do say 3 times a day is kind of good.
I mean, we tend to advise brush after every meal, floss, clean in between the teeth, mouthwashes, just general sort of hygiene and maintaining your normal regime, really.
And mouthwashes, they are useful then?
Yeah, they do.
Because you see them advertised on the telly all the time, and you think, are they really necessary?
They do. The thing is, mouthwashes never ever replace normal brushing, so you always need to use the mouthwash after you've used your toothbrush. But they do really help, especially if they've got fluoride. It's really, really good for your teeth. Fluoride it helps kind of strengthen the enamel, reduces the chance of you getting any cavities or decay inside your teeth. So they can really help, and you don't have to buy a very expensive posh mouthwash to keep your teeth healthy. Some simple ones that you can buy from any normal pharmacies, will keep your teeth nice and healthy.
And good for your breath as well. If you haven't got a tongue scraper.
Yeah, absolutely.
I mean, there's no substitute to coming to see the dentist, but every little thing helps, and if you can do these things, then it's just a bonus, really.
And any special offers that you're doing to tie in with National Smile Month?
Well, yeah, I mean, we're running free checkups for children under the age of 16 throughout National Smile Month, and really, good habits start young, and we want them to implement the habits at a young age and maintain them through to elderly age.
So get brushing, Definitely in the morning, definitely at night, and if you're having a lunchtime meal as well. Do you think people really should actually be taking a toothbrush around in their handbag or in their briefcase?
Yeah, we do have patients that do that. You know, they have a toothbrush at work, you know, which they can use to brush their teeth. It's quite common. You'll be surprised.
Obviously, don't annoy your partner too much that they've used it to clean the toilet bowl before.
Wow,
Make sure it's always fresh. Thank you very much, Faresh and Gursh from Hereford Dental Clinic. People can find you in Bath Street, can't they?
That's right, yeah.
And if they want the Hollywood look,
come
see you.
Yeah.
Or is it porcelains and whitening a speciality?
Absolutely.
All right, brilliant. Thank you, guys.